Good day everyone, this is Zxiakira C. Prodigalidad and I am from Nursing 216 and I am here to discuss deep breathing and coughing exercises. So first we have controlled breathing exercise which improves breathing efficiency of clients with obstructive respiratory diseases. Second is deep breathing exercises which encourages the patients to have or to take in slow and deep breathing rather than shallow and rapid breathing. The things we have to remember is number 1, check the patient's respiratory rate and also check the depth and chest expansions. Number 2, osculate the patient's lungs and check their individual activity patterns. Number 3, we have to check if they are in pain or they are in risk since it might affect the respiratory efforts. Number 4 is to plan a relief plan or check if the time is right and the frequency is right to do the procedure. Number 5 is of course we have to wash our hands or we have to do the hand washing techniques or procedures. And lastly, we have to make sure that we explain the purposes why we have to do this procedure and also offer the patient some oral hygiene after the procedure is done. So without further ado, we can now assess and do the deep breathing exercise and the coughing exercises. Good morning! So I am Zxiakira C. Prodigalidad, a nursing student from National University. May I ask what is your name?
My name is Zxiakira Prodigalidad.
Okay, Miss Shensen Prodigalidad, I am here to teach you about deep breathing and coughing exercises which improves our lungs capacity or our breathing efficiency and also eliminates the secretions in our lungs. So, is it okay if I take time to do this procedure?
Yes, of course.
So first, we will do the oscillation using my stethoscope and also I will take your respiratory rate. So is it okay if I touch you?
Yes.
Okay, thank you. Can you please hold your hair? Okay, in the back. So I will now take your respiratory rate. Okay, so thank you Ms. Shensen for your participation. So now we can do the deep breathing exercises. So can I sit here beside you?
Yes.
Thank you. So now we will do the deep breathing exercises. So first we have to sit straight, so like this. Okay, that's good position. So next is we have to breathe in our nose and then breathe out using our puff lips. So it's like this. So now it's your turn. That's right. So now the next step is we have to breathe in, repeat. So here we have to breathe in more air and expand our ribs and also let the air fill our lungs. So we have to repeat the steps. So we have to breathe in through our nose. So we have to repeat it 2 more times. So follow my leads and So the next step is we have to hold it in 3 seconds. So it will be like this. So now it's your turn. That's right, it's good. So now we will proceed with the cupping exercise. So I want you to hold this pillow so that it will be your support and also elevate your if it will ever be hurt your lungs. So hold this and hold it right behind your abdomen, and also you will cup 2 times. So it will be like this. So now it's your turn. Thank you. So that will eliminate all the secretions in your lungs. And also I will touch you again because I have to take your oscillation again. So is that okay with you?
Yes, of course.
Please hold your hair for a moment. Thank you. I will also get your respiratory rate again. So thank you for your participation, Ms. Shensen Prodigalidad. Also, do you have any questions? So I hope everything goes well for you and have a blessed day. Thank you. So for the evaluation of the deep breathing and coughing exercises, we have to make sure that we evaluated and documented all the patient's response, and also we also have to watch out for unwanted symptoms such as dizziness, tachypnea, or tachycardia. We also have to check the respiratory rate if it is equal or greater than or less than before. The chest expansion, which is the same as respiratory rate if it is equal to, greater than, and less than before. The lung auscultation if there are any abnormal signs, and also if the patient rather is resting comfortably. So that's it for deep breathing and coughing exercises.